This is Duke University.
Diagnosed with cancer in 2009, Bonnie McManus said the news hit her like a ton of bricks. Luckily, the senior coordinator for the Spanish Service Learning Program at Duke had access to first-class treatment through her Duke-sponsored health insurance. McManus is among about 61,000 employees, dependents, and retirees covered by Duke's health insurance plans, a benefit that Duke spent $219 million to provide in 2011. Today on Working at Duke Live, McManus shares more of her story that was chronicled in the October-November issue of Working at Duke. She's joined by Kyle Cavanaugh, Duke's Vice President for Administration, to delve deeper into the future of healthcare at Duke. Viewers are invited to send questions during the show by email to workingatduke.edu and on Twitter using the @WorkingAtDuke handle.
Good afternoon. Welcome to Working at Duke Live. I'm Paul Grantham, and our topic today is healthcare at Duke. I'm happy to have with me today Bonnie McManus, whose story, her battle with cancer was chronicled in the October issue of Working at Duke, and Kyle Cavanaugh, the Vice President for Administration, who has oversight over human resources. I'd like to invite you to join us in this discussion today. You can write in your questions or your comments by email at workingatduke.edu, or you can send us a tweet via Twitter at workingatduke. That's working at Duke, AT Duke. Kyle and Bonnie, thank you for joining us.
Thanks for having us.
Thanks for having us.
Bonnie, let me start with you. Your story really is a difficult one, and I want to kind of take us back, if you could, to tell us a little bit about when you first learned that you had cancer.
Okay. As you can imagine, it wasn't a great day. I had a biopsy done 2 weeks prior, and I had to wait for the results, which the waiting, I think the one thing I can say about cancer is the waiting really is the hardest part for almost every piece of it. Dr. Yoon called me at work, and I was so anxious to hear the results that because she asked me if I wanted to wait until I got home, which is never really a good sign. But she had prepared me on the day of the biopsy anyway, and I told her I really needed to know right then, and so I was working in my cubicle, and I got the news, and I was also taking notes because I also know when I get panicked I can't remember anything, so I was writing down everything she said about what kind of cancer it was and how bad it was, and I didn't understand anything. And I remember just bursting into tears, and I told her, just continue, I need to get all this down. And luckily a friend of mine had been on the way to meet me for lunch and had come up right as I got the news, and so she was there for me. And I just, broke down and cried, but the strange thing was, soon after, your body has a way of kind of rendering you numb, and I remember kind of saying, wow, I'm really hungry, and I wanted to go to lunch, and just kind of went numb for the next 6 to 8 hours because I couldn't believe the news that I had heard.
Right. So tell us a little bit, I know it's a difficult story to tell. Tell us a little bit about your decision and why you decided to share your story with us.
Yeah, it isn't an easy story to tell. It's clearly one that involves a lot of pain and very difficult period in my life. But I was diagnosed when I was 39, and I was at a point in my life where cancer was just the furthest thing from my mind. I never imagined. I don't have a history of it in my family, except one aunt on my father's side who got breast cancer when she was in her 70s. So it just wasn't something that I really thought had anything to do with me. And as most people, you're caught up in your daily life, you're thinking about your kids and what's for dinner and what your presentation at work is going to be tomorrow, not about cancer. It really just didn't seem like something that could happen to someone like me, and I think everyone thinks that, right? But when you're under 40, what I've come to find out is that breast cancer is really can be a very aggressive cancer for women under 40. It's a different type of cancer than it is for older women. And so I really felt that my own ignorance combined with a lot of people that I met later saying, I just really didn't think about getting cancer under 40. I just kind of assumed it's something that my grandmother had or my aunt had or something that's kind of an older person thing. So I really think it's important that people know that, you can get cancer at any age, and you can get breast cancer. There are women who have breast cancer in their 20s, and I was a part of an online forum for young women with breast cancer, and the stories are pretty amazing. But there are a lot of doctors out there who still tell women, don't worry about that. Come back in a year. It can't be cancer because you're, 25. So I think it's my responsibility to let people know that, people here at Duke can get cancer, can get breast cancer, and you need to have your mammograms, and you need to do what you can do to take care of your body, because don't rely on someone to tell you that you have breast cancer. You need to make sure you're finding out everything you need to know about your own health.
And did you find out after going through like a normal exam?
Yeah, I had gone in, I'd actually gone in a year early, almost a year early, for my mammogram because of healthcare. My insurance, it was right during the recession when everybody was talking about losing jobs. And it wasn't that my job was in jeopardy at all, but I've had that in the back of my mind that anybody can lose their insurance, anybody can lose their job, anybody can have health care today and not health care tomorrow. So I had a regular appointment with my doctor, and she suggested I get it done. And the receptionist at the clinic said, it's the summertime, it's a little quiet, you want to do it early? And I said, yeah, I guess it's a good time, and maybe I won't have health insurance next year. You kind of joke around about that. And then I did the first mammogram in the summer, and by the end of the summer we had found out in August the full results. So I think it was really lucky I did it early, and I went back and gave her flowers later because I thought I really owed her a big thanks for saying, do it early, it's summer, it's quiet. And I thought, wow, that was really fortuitous. So
Indeed. So you mentioned some feedback from others, and I know we've received a lot of positive feedback from people about the story itself, and I wanted to read an excerpt from a comment that someone had posted on the story that we put online. This is from Jana Kimball. She says, my son's chemo is $3,000 per month, and that's only for one medicine. He's now being treated back at Duke, where the chemo medicine itself costs $3,000. Our copay for a 3-month supply is $100. I really don't know what we do without his insurance. So, it's interesting this story has really seemed to connect with so many people who either have had cancer or know someone who has. What has been the feedback to you and the things that people have come up to you about with this story?
A lot of first of all, a lot of the feedback I've gotten has been from people just saying, wow, you got through it, you're strong, you did it, and kind of, I think there really still is this mystique around cancer in our society, and so people are still very surprised by it, I think, when someone in their own little community, and I think of Duke as being a very big community, but actually when you kind of drill down a little bit, it's not as big as we think. And so if you think about the people at Duke who have had cancer, it might not be very many, right? And then one of your coworkers is diagnosed, and you say, "Wow, that's really close to home." My secretary or my a faculty member in my department or a staff member has been diagnosed, and it becomes more real for them. So a lot of people have written to say basically, your story was really moving, thanks for sharing it. And a lot of people have said, wow, you shared such an intimate piece of yourself. Why did you do that? Or how did you do that? And I just think it's a part of the responsibility of being on the planet to let people know that they have to take care of themselves. So.
Right. You're probably an expert in Duke's health plan at this point, but how much did you know
Unfortunately.
Before all this happened?
Yeah, I didn't know anything about my health plan. I never had to use it, thankfully. So I knew that every year I signed back up for my health insurance, and mostly I used it towards things for my son, for regular vaccines or his annual checkup, or for his dental insurance or anything that he needed. And I was really just never someone who needed health insurance before this, so I actually didn't know much about, other than maybe my allergy medication and the copay for that. I didn't really know much at all. But I had to learn really quickly to ask for, if I didn't know what my copay was going to be, they would tell me, okay, you're going to have an MRI tomorrow and here's where you're going to go. And I would say, wait a minute, how much money do I need to bring, to pay for the MRI? And so, because a lot of the billing, when you have really good insurance, it actually goes on behind the scenes, and you don't see a lot of the billing, which is kind of a relief in some ways. But I looked back later and was pretty amazed.
So at what point did you really begin to appreciate and value what you had with your healthcare benefit?
It had to be the point in the story too that she mentioned, where the pharmacist said that my Neulasta cost $4,000, and I had no idea that my insurance was picking up essentially $3,900 of that. And I think, I'm not exactly sure, but I think I only paid $100 each Neulasta, and I had to do it 6 times, get a six supplies. So that was thinking about just that cost. And then I think also a chemo nurse mentioned that my chemo costs, something like $25,000 each time I go in. And I just went, whoa, okay. That was astounding. So I became aware of it, as soon as I started having to have big expenses, essentially.
Speaking of big expenses, Kyle, let me turn to you and ask about, Bonnie's one of, I think, 61,000 people here at Duke, employees and family members covered by Duke's health plan. What's the impact to the plan? I mean, that's a lot of expense that's being picked up by the Duke healthcare plan.
Yeah, thanks, Paul. First, I want to start by just commending Bonnie. This has been an amazing story, and for those of us who have had to navigate a lot of cancer experiences, either in our own personal lives or certainly in the dozens, the strength and compassion that you've shown going through this has been amazing, so good for you. As you said, we're a private employer. We employ now nearly 35,000 employees. Nearly 30,000 of those are now benefit eligible. And we have about 61,000 total covered lives in our plan. The total cost of that is now in excess of $200 million annually. Now, an interesting piece that we'll come back to is 25% of that is exactly what Bonnie was talking about in prescription medication. So we're spending in excess of $52 million annually on medication. We've done a whole host of things to try to manage those costs in a proactive way over the last several years, and I think it might be important to mention a couple of those. So we look at this from a very strategic standpoint. We certainly look at our plans as they compare to the market, and the market for us, as you know, cuts across a number of different industries. So not only higher education, but academic medicine, healthcare, as well as kind of our local and regional kind of employers that we compete with. Our plans are viewed as very competitive. We're not above the market in a lot of different areas. They're really kind of right where we would like them to be. But we've been able to do that over the last couple of years by implementing a whole host of different strategies. Some of those are on the preventive side, so we have a very active on-site health promotion program. We also have a very sophisticated disease management program, and for those individuals that find themselves in situations where they have a chronic disease, we have a program referred to as Duke Well that helps to kind of manage that along. But we also have been very aggressive in the prescription space, and I'd be happy to kind of dive into that in a little bit.
Yeah, sure. Could you, I'd like to, well, before we do, I just want to remind people that they can participate in this conversation. You can send your emails to working@duke.edu, or you can send via Twitter at the handle working@AT-Duke. So let's go into that a little bit more, Kyle, and tell us a little bit about how Duke has helped manage that expense, especially with prescription drug cost and being such a major component of the plan.
Yeah, I think first it's important to understand that as a private employer, we are self-insured. So what does that mean in kind of lay terms? There is no insurance company. I mean, we are the insurance company. So the way that the dollars actually get created is a combination of individuals who pay premiums and then the institution that's paying a portion of that premium. That, if you will think, goes into a pot, and claims get paid out of that, and then we hire what we refer to as third-party administrators, or TPAs, to actually help kind of process that. So that's all on the design side. We go into annual negotiations in each of the different components. So we negotiate on the facility side, on our physician side, and certainly on mental health and medication. The medication space, what we found 4 years ago is we were actually an outlier in two very critical areas. One was the use of generic medication, and then the utilization of what's referred to as mail order. And that's used for chronic types of situations that people have. So we put in incentives for people. We didn't take the option away, but we put in incentives for people to use generic medication and also to use mail order. And if you take a look at where the data was in 2008, 2009, and where it is in 2012, we've moved both of those needles rather substantially, and now we're actually considered an industry leader in both of those categories. Why is both of those things important to us is each one of those are representing about a $5 to $6 million annual saving just in our medication. So that those strategies have played out incredibly well for us.
That's good news for Bonnie and myself as well, as covered. So tell us, we just had this election, and it looks like healthcare reform is going to be with us. The landscape is changing with healthcare. Can you tell us a little bit about what has already happened with healthcare reform and what we can expect in the next couple of years?
Certainly. So healthcare reform has been under discussion in this country for decades. Prior to actually the current sitting president being able to push that through several years ago, as it was starting to kind of make its way through various stages in its approval process, we were very active in modeling what are the impacts and what could that mean. And I'll just kind of highlight a couple of those types of issues. So we saw back now 2 years ago the extension of healthcare benefits up to age 26 for a dependent, irrespective of whether they are a full-time student or not. So that was a big change, and we were monitoring kind of what that would do for us. We have seen an increase in our population, but not a dramatic one that's causing a lot of cost in there. So that was one of the pieces that we were able to navigate. The other is we elected what is referred to as to maintain grandfather status, and so that meant that we could do certain things, but we also couldn't do other things. And so each of those turns have been very strategic in nature. Now, as we move forward, we're going to see a couple of changes here that go into effect actually January 1 of 13. So we'll see the flexible spending account get capped at a limit of $2,500. So that's one way that the federal government has put in to actually create some revenue streams to pay for national health care reform. We will also see in W-2s that get published in 2013 that there will be a new box on there, and that will get populated, and that box will show what the employer is contributing to an employee on behalf of the healthcare plan. That's a start of what we are managing looking way out in 2018 of where what will go in 2018 is what is referred to as the Cadillac tax. And so that is where if an employer's plan is viewed as too rich. So that's something that we're managing and watching and assessing as we go forward there. In between 2013 and 2018, we have a lot of different things that come into place. Most importantly, in 2014, the healthcare exchanges. Now, our benefits staff doesn't like me actually referring to it exactly this way, where I'm already done with our open enrollment that we just concluded last week for 2013, and we've been spending quite a bit of time kind of modeling 2014 and 2015. We see a lot of stability in our plans for 2013, and we'll probably see a fair amount of stability for 2014. But as we look at 2015 and the exchanges start to mature, that will be a reassessment time to see what, if any, relationship those exchanges will have for our healthcare plans.
Right. Thank you. We've got a question or two that's been submitted. I want to encourage people to join us in our discussion today. Again, you can do that at workingatduke.edu, or you can send it in via Twitter at workingatduke. So the last question, I believe, sounds like it's related to healthcare reform. Explain how the new healthcare plan will affect employees. We've talked a little bit about the plan and some changes that we can anticipate, but what changes do you anticipate would affect employees?
We don't expect very much, as we've just communicated through 2013, and as we've kind of started our modeling for 2014, I would also say that I see that as a year of stability as well. But what happens in 2014 is the state-based health exchanges come into being. We will use the early part of 14 to look at the viability of those exchanges and to take a look at whether or not it makes sense for either all or a certain portion of our population in 2014 to actually move into those state-based exchanges. We have a lot more assessment to do for 2015, but that's how I see this shaping up.
Right. What about around us in terms of our peers and our competitors, both locally? Do you see changes happening there as well?
Yeah, I think that you'll see in the markets that we operate in research, academic medicine, and in higher education, I think you'll see a slow adoption into the health exchanges. But you're certainly seeing other segments of the workforce in the manufacturing or retail arenas that are going to move very quickly into the exchanges. We've been very fortunate that we've had, as we've heard before, a very rich and healthy benefit plan. To the extent possible, and with economics being a center to that we can afford to continue to do that, we want to maintain that as long as we can.
Bonnie, let me come back to you and ask, you, I think in the story we talked about you journaling your experience and you mentioned needing to write things down. Can you tell us a little bit more about why you decided to journal your experience with cancer?
Yeah, I think there are two main reasons. One is that a diagnosis like cancer is extremely overwhelming for anyone to hear, and every time you go in for an appointment, you're being given a lot of information, and it's not necessarily information that if you weren't diagnosed with cancer you wouldn't be able to process, but because you're operating under kind of diminished emotional capacity sometimes, or you're very emotional about the things that are happening to you, you just can't process that much information. So I found it really great to write things down. Every appointment that I went to, I wrote down the suggestions for my treatment and the medications and everything, and then would talk about it with my husband later, who was also taking notes. But I also found that journaling, I'm a very visual person. Journaling helped me get things down on paper that I didn't feel like I had anyone else to talk to about. It's a very isolating experience to be diagnosed with cancer, especially as a person who's in the workforce, who's got who's raising children, who's kind of in a place in their life where there really should be other things going on rather than cancer. So I didn't feel like I had a community really to talk to, and so my journal became the place where I vented or where I expressed my deepest fears about my diagnosis. Or I also am an artist and I like to draw, so I drew a lot of really funny pictures and about how I was feeling and that kind of thing.
You mentioned earlier about your copay when you went to the pharmacy. Kyle, I was wondering if you might speak to kind of people may not really understand or appreciate what percentage of like the healthcare premium that Duke pays on behalf of employees.
Sure. I think as Bonnie had shared in her own personal situation, communicating the value and the economics about benefits is always a challenging scenario. I think it's human nature that people don't pay as close attention to it until they actually need it. So one of the things that we do, as you know, we put out on an annual basis a benefit statement, and it actually shows kind of what the value of the benefit is. We try as best we can during the annual enrollment period to actually communicate those pieces as well. But in general, what the university is paying is about 80% of that cost, and the individual paying about 20% of that cost.
I think we have time for maybe one more question. And Bonnie, this one comes in for you. It's what is your prognosis now, and how do you stay optimistic?
Wow. My prognosis is good, actually. I have undergone almost every treatment you can go through to prevent cancer happening again, and I'm currently on a preventative medication called tamoxifen, and hopefully that will keep me from ever having to go through any other treatment. Tamoxifen has its side effects though, and it's not completely without problems, so it can be challenging to stay optimistic about continued health problems. I don't have an easy time with post-cancer treatment. I think people kind of assume once you're treated that life just goes back to normal, but it really doesn't. Your whole life has changed, and I now have to deal with things that I never thought I would ever have to deal with in terms of my own personal health and my strengths and my abilities. Things that are no longer easy for me that used to be very easy for me. So it is hard to stay optimistic, but you have to find things in life that you love and do them, because you do realize that life's too short not to. So.
And in closing, I think a friend of yours has written in, Pat McPherson. She says, "My dear
Pat.
friend Bonnie, continued prayers going up and many blessings in return."
Oh, that's very sweet.
So I'd like to thank both you, Bonnie and Kyle, for joining us today. And stay tuned. I'm Paul Grantham, and this is Working at Duke Live. Thank you.